Question 1. The efficiency study reveals that a new automated system can pre-screen patients for HBOT eligibility, flagging potential contraindications based on electronic health record data. A patient's record indicates a history of pneumothorax, which is a known absolute contraindication. However, the automated system, due to a data entry anomaly, does not flag this specific condition. The CHT is tasked with reviewing the automated screening results before proceeding with treatment. Which of the following actions best upholds the CHT's professional responsibilities and ensures patient safety? Option A. Independently review the patient's complete medical history and diagnostic reports to verify the automated screening results, and if the pneumothorax history is confirmed, refuse to initiate HBOT and consult with the hyperbaric physician. Option B. Inform the patient that the automated system did not flag any issues and proceed with treatment, but advise them to mention their past pneumothorax to the hyperbaric physician during the session. Option C. Override the automated system's lack of flagging and initiate a manual review of all potential contraindications, even if the system indicates no issues, to ensure thoroughness. Option D. Proceed with HBOT as scheduled, assuming the automated system is accurate and the absence of a flag indicates no contraindication, to maintain the efficiency gains from the study. The correct answer is A. Independently review the patient's complete medical history and diagnostic reports to verify the automated screening results, and if the pneumothorax history is confirmed, refuse to initiate HBOT and consult with the hyperbaric physician. Explanation. This scenario presents a professional challenge due to the critical nature of contraindications in hyperbaric oxygen therapy, HBOT. A certified hyperbaric technologist, CHT, must exercise meticulous judgment to ensure patient safety, as overlooking a contraindication can lead to severe adverse events or even fatalities. The efficiency study, while aiming to streamline processes, must not compromise the thoroughness of patient screening. The correct approach represents best professional practice because it prioritizes patient safety above all else, aligning with the fundamental ethical and regulatory obligations of a CHT. Adherence to established protocols for identifying and managing contraindications is paramount. This involves a comprehensive review of patient history, current medical status, and appropriate diagnostic information, as mandated by regulatory bodies overseeing hyperbaric medicine. The CHT's role is to act as a gatekeeper, ensuring that HBOT is administered only when it is medically appropriate and safe for the individual patient. An incorrect approach that relies solely on the efficiency study's automated screening without independent verification by the CHT would represent a significant regulatory and ethical failure. This failure stems from a dereliction of duty to perform due diligence in patient assessment. Specifically, it violates the principle of do no harm and potentially breaches guidelines set by organizations like the Undersea and Hyperbaric Medical Society, UMS, or equivalent national bodies that provide standards of care. Such an approach could also be seen as a failure to maintain professional competence and a lack of critical thinking, essential for a CHT. Another incorrect approach that might dismiss a potential contraindication based on anecdotal evidence or a perceived low risk would also be professionally unacceptable. This demonstrates a disregard for established medical contraindications and a failure to adhere to evidence-based practice. Ethically, it prioritizes convenience or a subjective assessment over objective medical guidelines, potentially exposing the patient to undue risk. This also undermines the credibility of the hyperbaric facility and the CHT's professional standing. The professional decision-making process for similar situations should involve a multifaceted approach. First, a thorough understanding of all established contraindications for HBOT is essential, including absolute and relative contraindications. Second, a systematic patient screening process must be implemented, which includes a detailed medical history, physical examination, and review of relevant diagnostic tests. Third, the CHT must possess the critical thinking skills to evaluate the information gathered and identify any potential red flags. Finally, clear communication channels with the referring physician and the hyperbaric physician are crucial for clarifying any uncertainties and making informed decisions regarding patient eligibility for HBOT. The CHT's role is not merely to operate the chamber, but to be an integral part of the patient care team, ensuring safety and efficacy. Question 2. Regulatory review indicates that a hyperbaric facility utilizes various types of hyperbaric chambers for patient treatment. A technologist is tasked with ensuring that all chambers are correctly identified and that operational protocols are aligned with their specific designs. Which of the following classifications most accurately distinguishes between the primary types of hyperbaric chambers based on their fundamental design and patient capacity, as relevant to operational safety and regulatory oversight? Option A. Chambers are classified by their manufacturer's brand name and the year of their most recent maintenance service. Option B. Chambers are classified as either monoplace, designed for a single patient, or multiplace, designed for multiple patients, with further distinctions based on pressure capabilities and gas delivery systems. Option C. Chambers are classified solely by their internal volume and the number of windows present. Option D. Chambers are classified based on their primary material of construction, such as steel or acrylic, and their color. Correct answer is B. Chambers are classified as either monoplace, designed for a single patient, or multiplace, designed for multiple patients, with further distinctions based on pressure capabilities and gas delivery systems. Explanation: scenario analysis. This scenario presents a professional challenge related to ensuring patient safety and regulatory compliance within a hyperbaric facility. The technologist must accurately identify and differentiate between various hyperbaric chamber designs based on their operational characteristics and intended use. Misidentification could lead to improper operational procedures, inadequate safety protocols, or noncompliance with facility accreditation standards, all of which pose significant risks to patient well-being and the facility's operational integrity. Careful judgment is required to apply knowledge of chamber types to specific operational contexts. Correct approach analysis. The correct approach involves accurately classifying the chamber based on its design features and operational principles, such as whether it is a multiplace or monoplace chamber, its pressure capabilities, and its gas delivery system. This aligns with the fundamental principles of hyperbaric safety and operational protocols, which are often dictated by regulatory bodies and accreditation organizations. For instance, the National Fire Protection Association (NFPA) standards, which are frequently referenced in U.S. hyperbaric regulations, provide specific guidelines for the design, installation, and operation of different types of hyperbaric chambers. A technologist's ability to correctly identify a chamber ensures adherence to these standards, proper patient management, and appropriate emergency response planning, all of which are critical for best professional practice. Incorrect approach is analysis. An incorrect approach would be to classify a chamber based solely on its external appearance, without considering its internal design, operational pressure limits, or intended patient capacity. For example, mistaking a monoplace chamber designed for mild hyperbaric therapy at lower pressures for multiplace chamber used for diving medicine at higher pressures would lead to the application of inappropriate safety protocols and treatment regimens. This represents a failure to adhere to the specific operational requirements and safety standards associated with each chamber type, potentially violating guidelines from organizations like the Undersea and Hyperbaric Medical Society (UMS), or the Accreditation Association for Ambulatory Healthcare (AAHC), which mandate proper chamber classification and operation. Another incorrect approach would be to assume all chambers are functionally identical, disregarding the distinct design differences that impact gas delivery, pressure control, and patient monitoring, thereby compromising safety and regulatory compliance. Professional reasoning. Professionals should approach this situation by first reviewing the facility's operational manuals and any available chamber specifications. They should then correlate these details with their understanding of established hyperbaric chamber classifications and relevant regulatory guidelines, e.g., NFPA, UMS recommendations. When faced with uncertainty, the professional decision-making process should involve consulting with a supervisor or a more experienced colleague, and if necessary, referencing official documentation or manufacturer specifications to ensure accurate identification and adherence to all safety and regulatory requirements. Question 3. Governance review demonstrates a recurring pattern of minor pressure fluctuations within a specific hyperbaric chamber during routine treatments. While patient outcomes have not been negatively impacted to date, the review suggests a need to optimize the operational response to such anomalies to ensure consistent adherence to safety standards and equipment longevity. As the lead technologist, what is the most appropriate course of action to address this identified process gap? Option A. Immediately initiate a comprehensive diagnostic evaluation of the chamber's pressure regulation system, involving manufacturer technical support and a review of all maintenance logs, while temporarily rerouting non-critical treatments to other available chambers if feasible. Option B. Advise the medical director that the pressure fluctuations are minor and not impacting patient care, suggesting that further investigation is unnecessary at this time to avoid disrupting the treatment schedule. Option C. Instruct the junior technologist to perform a series of unauthorized adjustments to the chamber's control panel settings to attempt to stabilize the pressure, based on anecdotal experience. Option D. Continue current treatment protocols, monitoring the pressure fluctuations closely, and document them in the patient's chart, assuming the system will self-correct or that the deviations are within acceptable operational tolerances. The correct answer is A. Immediately initiate a comprehensive diagnostic evaluation of the chamber's pressure regulation system, involving manufacturer technical support and a review of all maintenance logs, while temporarily rerouting non-critical treatments to other available chambers if feasible. Explanation. Scenario analysis. This scenario presents a common challenge in hyperbaric facilities, balancing the need for efficient patient throughput with the absolute imperative of patient safety and equipment integrity. The governance review highlights a potential gap in operational protocols that could lead to compromised treatment delivery or equipment malfunction. The technologist must navigate this situation by prioritizing established safety and operational standards over expediency, recognizing that deviations can have serious consequences. The challenge lies in identifying the most effective and compliant method to address the identified issue without disrupting patient care or violating regulatory guidelines. Correct approach analysis. The correct approach involves a systematic and documented process that aligns with established hyperbaric operational protocols and regulatory expectations. This includes immediate reporting of the anomaly, thorough investigation, and adherence to manufacturer guidelines and facility-specific standard operating procedures, SOP. This method ensures that any potential equipment issue is addressed comprehensively, minimizing risk to patients and maintaining the integrity of the hyperbaric chamber. It reflects best professional practice by prioritizing patient safety, regulatory compliance, e.g., adherence to FDA regulations for medical devices, OSHA for workplace safety, and potentially NFPA standards for hyperbaric facilities, and the long-term reliability of critical life support equipment. This approach fosters a culture of safety and continuous improvement, essential in a high-risk environment. Incorrect approaches analysis. Continuing treatment without addressing the anomaly represents a direct violation of patient safety protocols and regulatory mandates. It prioritizes operational continuity over the well-being of the patient and the integrity of the equipment, which could lead to adverse events, equipment failure, and significant legal and ethical repercussions. This approach disregards the principle of do no harm and fails to meet the standards expected of a certified hyperbaric technologist. Attempting to troubleshoot or adjust the equipment without proper authorization or adherence to manufacturer guidelines is also a critical failure. This bypasses established safety checks and validation procedures, potentially exacerbating the problem or creating new hazards. It violates regulatory requirements for equipment maintenance and operation, which often mandate that only qualified personnel follow approved procedures. This approach demonstrates a lack of professional judgment and a disregard for established safety protocols. Ignoring the anomaly and hoping it resolves itself is the most negligent approach. It signifies a failure to uphold professional responsibilities and a disregard for the potential risks involved. This passive stance can lead to serious patient harm, equipment damage, and regulatory noncompliance, as facilities are expected to proactively manage and mitigate risks. Professional reasoning. When faced with an equipment anomaly during a hyperbaric treatment, a certified hyperbaric technologist should employ a structured decision-making process. This begins with immediate assessment of the patient's status and the nature of the anomaly. The next step is to consult established protocols, including manufacturers' operating manuals and facility SOPs. If the anomaly is not immediately resolvable within these guidelines, the technologist must escalate the issue to the appropriate supervisor or medical authority. Documentation of the anomaly, the steps taken, and the resolution is paramount. This systematic approach ensures that patient safety is always the primary concern. Regulatory compliance is maintained, and equipment integrity is preserved. Question 4. The risk matrix shows a moderate likelihood of a minor pressure fluctuation during a routine hyperbaric oxygen therapy (HBOT) session, with a low impact on patient safety. What is the most appropriate immediate response by the hyperbaric technologist? Option A. Ignore the minor pressure fluctuation and continue the therapy as scheduled without any changes. Option B. Observe the patient and chamber parameters closely. Document the fluctuation and any patient response, and continue therapy unless the fluctuation worsens or the patient shows signs of distress. Option C. Immediately increase the chamber pressure to counteract the observed fluctuation. Option D. Immediately abort the hyperbaric treatment and evacuate the patient from the chamber. The correct answer is B. Observe the patient and chamber parameters closely, document the fluctuation and any patient response, and continue therapy unless the fluctuation worsens or the patient shows signs of distress. Explanation. The risk matrix shows a moderate likelihood of a minor pressure fluctuation during a routine hyperbaric oxygen therapy (HBOT) session, with a low impact on patient safety. This scenario is professionally challenging because it requires the hyperbaric technologist to balance the need for continuous patient care with the imperative of maintaining strict safety protocols. Overreacting to a minor fluctuation could disrupt therapy and cause patient anxiety, while underreacting could potentially escalate a minor issue. Careful judgment is required to assess the real-time situation and determine the most appropriate response. The correct approach represents best professional practice because it aligns with the principles of proactive risk management and evidence-based intervention as outlined in hyperbaric safety guidelines. It involves immediate but measured observation and documentation, followed by a decision based on established protocols and the patient's clinical status. This approach prioritizes patient well-being by ensuring that any deviation from normal parameters is noted and addressed without unnecessary alarm or disruption. It reflects a commitment to continuous quality improvement by documenting the event for potential future analysis. An incorrect approach that involves immediately aborting the treatment without further assessment fails to adhere to established protocols for minor deviations. This could be considered a failure to exercise professional judgment and may lead to unnecessary patient distress and disruption of medically indicated therapy. It also fails to document the event adequately, hindering any potential review or learning from the incident. Another incorrect approach, which is to ignore the fluctuation and continue therapy as if nothing happened, represents a significant regulatory and ethical failure. This directly contravenes the duty of care owed to the patient and the requirement to monitor vital signs and chamber parameters diligently. It could lead to a missed opportunity to intervene before a minor issue becomes a serious safety concern, potentially violating patient safety regulations and professional standards of practice. A further incorrect approach, which is to immediately increase chamber pressure to compensate for the fluctuation, is also professionally unacceptable. This action is not supported by standard operating procedures for minor pressure variations and could introduce new, potentially dangerous pressure dynamics within the chamber, directly endangering the patient. It demonstrates a lack of understanding of pressure control mechanisms and safety protocols. A professional reasoning process for similar situations should involve a systematic approach. First, recognize and acknowledge the deviation. Second, assess the magnitude and nature of the deviation against established normal operating parameters and safety thresholds. Third, consult relevant protocols and guidelines. Fourth, consider the patient's clinical condition and any immediate signs of distress. Fifth, document all observations and actions meticulously. And finally, communicate with the supervising physician if the deviation warrants it or if the technologist is unsure of the appropriate course of action. This structured decision-making process ensures that patient safety remains paramount while maintaining the integrity of the therapeutic treatment. Question 5. Quality control measures reveal that a patient undergoing hyperbaric oxygen therapy at 2.0 ATA is exhibiting significantly higher than anticipated tissue oxygenation levels, as indicated by advanced monitoring probes, despite no changes in the prescribed oxygen concentration or chamber pressure. The certified hyperbaric technologist, CHT, must determine the most appropriate immediate course of action. Option A. Assume the advanced monitoring probes are malfunctioning and recalibrate them before proceeding with the treatment. Option B. Immediately terminate the hyperbaric treatment session due to the unexpected physiological response and await physician instruction. Option C. Conclude that the patient is simply responding exceptionally well to therapy and continue the treatment as prescribed without further immediate action. Option D. Document the findings, correlate them with the patient's clinical presentation and vital signs, and immediately report the observation to the supervising physician for further evaluation and guidance. The correct answer is D. Document the findings, correlate them with the patient's clinical presentation and vital signs, and immediately report the observation to the supervising physician for further evaluation and guidance. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the certified hyperbaric technologist, CHT, to interpret a subtle but significant deviation from expected physiological responses during hyperbaric oxygen therapy, HBOT. The challenge lies in distinguishing between a normal physiological adaptation and a potential adverse event, directly impacting patient safety and treatment efficacy. The CHT must apply their understanding of Henry's law, which governs gas solubility, to explain the observed phenomenon and determine the appropriate course of action. This requires a deep understanding of how increased partial pressures of oxygen affect its dissolution in body tissues, and how individual patient factors might influence this process. Correct approach analysis. The correct approach involves recognizing that the observed increase in tissue oxygenation, while seemingly beneficial, could indicate an individual's heightened sensitivity or an underlying condition that alters their response to HBOT. Henry's law dictates that at a constant temperature, the amount of dissolved gas in a liquid is directly proportional to the partial pressure of that gas above the liquid. In HBOT, the increased partial pressure of oxygen leads to greater oxygen dissolution in blood and tissues. However, the rate and extent of this dissolution can be influenced by factors such as perfusion, metabolic rate, and the presence of certain pathologies. A CHT's best professional practice is to document this finding meticulously, correlate it with the patient's clinical presentation and vital signs, and immediately report it to the supervising physician. This aligns with regulatory guidelines that mandate accurate patient monitoring, prompt reporting of deviations, and collaborative decision-making in patient care. The ethical imperative is to prioritize patient safety by ensuring that any unusual physiological response is thoroughly investigated to rule out adverse effects and to optimize the treatment plan. Incorrect approaches analysis. One incorrect approach would be to dismiss the observation as a normal, albeit pronounced, response to HBOT without further investigation. This fails to acknowledge the potential for individual variability and the risk of overlooking a developing complication. Ethically, this constitutes a failure in due diligence and patient advocacy. Regulatory frameworks for healthcare professionals emphasize proactive monitoring and reporting of any patient status changes that deviate from expected norms. Another incorrect approach would be to immediately terminate the treatment based solely on this observation without consulting the physician. While caution is warranted, an abrupt cessation without physician input could be premature and deprive the patient of necessary therapy. This bypasses the established chain of command and collaborative care model, which is a cornerstone of safe medical practice and is often implicitly or explicitly required by regulatory bodies. A third incorrect approach would be to attribute the finding to equipment malfunction without considering physiological factors. While equipment issues are a possibility, a CHT's primary responsibility is to assess the patient's physiological response first. This approach neglects the direct application of their knowledge of gas laws and physiology to the patient's condition and could lead to a delayed diagnosis of a patient-specific issue. Regulatory guidelines require a comprehensive assessment that includes both patient and equipment factors, but patient well-being is paramount. Professional reasoning. When faced with an unexpected physiological response during HBOT, a CHT should employ a systematic decision-making process. First, thoroughly assess the patient's current clinical status, including vital signs and any subjective complaints. Second, recall and apply relevant scientific principles, such as Henry's law, to understand the potential physiological mechanisms at play. Third, meticulously document all observations, including the specific parameters that deviated from the norm and the patient's response. Fourth, communicate these findings clearly and concisely to the supervising physician, providing all relevant data for their informed decision. This collaborative approach ensures that patient care is guided by both technical expertise and medical judgment, adhering to the highest standards of professional practice and regulatory compliance. Question 6. Strategic planning requires a certified hyperbaric technologist to anticipate patient responses to varying ambient pressures. Considering Boyle's law, which states that for a fixed amount of gas at constant temperature, pressure and volume are inversely proportional, how should a technologist best prepare for a patient's ascent from a hyperbaric dive? Option A. Monitor the patient for signs of discomfort and assume gas volumes will remain stable throughout the ascent. Option B. Focus solely on the patient's breathing rate, as this is the primary indicator of physiological change during ascent. Option C. Ensure the patient is aware that gas volumes within their body will decrease as pressure decreases during ascent. Option D. Prepare to manage potential gas expansion in the patient's air-filled cavities as ambient pressure decreases. The correct answer is C. Ensure the patient is aware that gas volumes within their body will decrease as pressure decreases during ascent. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a hyperbaric technologist to apply fundamental physics principles, specifically Boyle's law, to a real-time patient care situation involving pressure changes. Misunderstanding or misapplying Boyle's law can lead to incorrect patient management, potentially causing barotrauma or inadequate therapeutic effects. The technologist must not only understand the law, but also its practical implications for physiological responses within the hyperbaric environment, ensuring patient safety and treatment efficacy within the established regulatory framework. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing patient safety and adherence to established protocols derived from scientific principles. It acknowledges that as ambient pressure increases, gas volume decreases proportionally, and vice versa. This understanding is critical for anticipating and managing physiological changes in the patient's body, particularly in air-filled cavities like the lungs, middle ears, and sinuses. Adhering to this principle ensures that the technologist can anticipate potential issues like ear or sinus squeeze during descent or gas expansion during ascent, allowing for appropriate interventions or adjustments to the dive profile as dictated by the patient's condition and the hyperbaric facility's safety guidelines, which are implicitly informed by these physical laws. Incorrect approach is analysis. An approach that disregards the direct relationship between pressure and gas volume, as described by Boyle's law, is fundamentally flawed. This would represent a failure to apply basic scientific principles essential for safe hyperbaric operations. Such a failure could lead to overlooking critical physiological responses to pressure changes, such as the expansion of gases in body cavities during ascent, which can cause barotrauma if not managed. This directly contravenes the implicit regulatory requirement for competent practice based on scientific understanding. Another incorrect approach would be to focus solely on the patient's subjective comfort without considering the underlying physical principles. While patient comfort is important, it is not a substitute for understanding the physiological consequences of pressure changes. Relying solely on subjective feedback without applying Boyle's law could lead to a situation where a patient is experiencing or is at risk of barotrauma, but it is not recognized or addressed because the technologist has not considered the physical forces at play. This demonstrates a lack of professional diligence and a failure to uphold the standard of care expected of a certified hyperbaric technologist. A third incorrect approach might involve assuming that gas volumes within the body remain constant regardless of external pressure. This directly contradicts Boyle's law and would lead to a dangerous underestimation of the forces acting on the patient's tissues. For instance, during ascent, gases trapped in the lungs or sinuses would expand significantly, and if this expansion is not anticipated and managed, it can cause severe tissue damage. This demonstrates a profound lack of understanding of hyperbaric physics and a direct violation of the safety principles that underpin hyperbaric medicine. Professional reasoning. Professionals should approach situations involving pressure changes by first recalling and applying the relevant physical laws, such as Boyle's law. They should then consider how these laws directly impact the physiological systems of the patient. This involves anticipating potential problems based on these principles and having pre-established protocols for managing them. Continuous monitoring of the patient's condition, coupled with an understanding of the physics involved, allows for proactive rather than reactive care, ensuring patient safety and optimal treatment outcomes within the regulatory framework governing hyperbaric practice. Question 7. Benchmark analysis indicates that a patient undergoing a routine hyperbaric oxygen therapy session reports sudden onset of ear pain, dizziness, and a feeling of fullness in the ears during descent. Considering the potential for barotrauma, which of the following represents the most appropriate immediate course of action for the certified hyperbaric technologist? Option A. Instruct the patient to perform a Valsalva maneuver forcefully to equalize pressure, despite the reported dizziness. Option B. Immediately stop the descent, assess the patient's symptoms and vital signs, and consult with the hyperbaric physician regarding appropriate management, which may include emergency decompression. Option C. Administer a mild sedative to help the patient relax and ignore the discomfort during the remainder of the dive. Option D. Continue the descent as scheduled, assuming the symptoms are minor, and will resolve with continued exposure to pressure. The correct answer is B. Immediately stop the descent, assess the patient's symptoms and vital signs, and consult with the hyperbaric physician regarding appropriate management, which may include emergency decompression. Explanation. Scenario analysis. This scenario presents a common yet critical challenge in hyperbaric medicine, managing a patient experiencing symptoms suggestive of barotrauma. The professional challenge lies in accurately identifying the cause of the symptoms, differentiating between various potential barotrauma types and other emergent conditions, and implementing timely, appropriate interventions while adhering to strict safety protocols and patient care standards. The urgency of the situation, coupled with the potential for rapid deterioration, necessitates a swift and informed decision-making process. Correct approach analysis. The correct approach involves a systematic assessment that prioritizes patient safety and evidence-based practice, aligning with the principles of hyperbaric patient care and regulatory guidelines. This includes immediate cessation of the dive, thorough clinical assessment of symptoms and vital signs, and prompt application of appropriate decompression protocols if indicated. This approach is justified by the regulatory framework for hyperbaric medicine, which mandates immediate action to mitigate harm from pressure-related injuries, and emphasizes the technologist's role in recognizing and responding to adverse events. Ethical considerations also dictate prioritizing patient well-being and acting within the scope of practice to prevent further injury. Incorrect approaches analysis. Continuing the dive or proceeding with standard decompression without a thorough assessment of barotrauma symptoms is a critical regulatory and ethical failure. This directly violates the principle of patient safety and the requirement to respond to adverse events. It risks exacerbating the barotrauma, potentially leading to severe complications or permanent injury, and demonstrates a disregard for established safety protocols. Ignoring or downplaying the patient's reported symptoms without a proper clinical evaluation is another significant failure. This neglects the technologist's responsibility to take patient complaints seriously and conduct a comprehensive assessment. Such an approach can lead to delayed or misdiagnoses, preventing timely and effective treatment, which is a breach of professional duty and ethical care standards. Implementing a treatment protocol not specifically indicated for the suspected barotrauma, or one that could potentially worsen the condition, represents a failure to adhere to best practices and regulatory guidelines. This could involve administering inappropriate medications or attempting a decompression profile that is contraindicated for the specific type of barotrauma suspected, thereby increasing patient risk. Professional reasoning. Professionals should approach such situations by first recognizing the potential for barotrauma based on the patient's reported symptoms and the dive profile. The immediate priority is to ensure patient safety by halting the dive if it is ongoing. Comprehensive clinical assessment, including a detailed history of symptoms, vital signs, and a physical examination, is crucial. This assessment should guide the decision-making process regarding the appropriate next steps, which may include initiating emergency decompression, administering oxygen, or consulting with the hyperbaric physician. Decision-making should be guided by established protocols, regulatory requirements, and a commitment to patient-centered care, always erring on the side of caution when patient well-being is at stake. Question 8. Stakeholder feedback indicates a concern regarding the consistent delivery of appropriate gas mixtures during hyperbaric oxygen therapy sessions. A hyperbaric technologist is preparing a patient for a routine treatment session for diabetic foot ulcers, which typically requires a specific partial pressure of oxygen, PO2, delivered at a consistent flow rate. The technologist has access to a standard medical oxygen concentrator, which is designed to produce oxygen at a purity of approximately 90–95% at ambient pressure, and also has access to compressed air cylinders. Considering the regulatory framework for certified hyperbaric technologists, which of the following represents the most appropriate action to ensure the correct gas mixture is delivered for this therapeutic session? Option A. Use the medical oxygen concentrator, but adjust its settings to maximize oxygen output, assuming higher purity is always better regardless of protocol. Option B. Administer a mixture of medical oxygen from the concentrator and compressed air to achieve a higher oxygen concentration than the concentrator alone can provide. Option C. Utilize the medical oxygen concentrator, ensuring its output meets the required purity and flow rate as specified by the hyperbaric protocol for this treatment. Option D. Administer compressed air, as it is a readily available gas mixture that contains oxygen and can be delivered at high pressures. The correct answer is C. Utilize the medical oxygen concentrator, ensuring its output meets the required purity and flow rate as specified by the hyperbaric protocol for this treatment. Explanation. Scenario analysis. This scenario presents a professional challenge due to the critical nature of oxygen delivery in hyperbaric therapy. The technologist must balance patient safety, regulatory compliance, and operational efficiency when selecting gas mixtures. Misunderstanding or misapplication of oxygen concentrator capabilities and gas mixture principles can lead to suboptimal treatment, patient harm, or regulatory violations. The challenge lies in interpreting the nuances of oxygen purity, flow rates, and the specific requirements of different hyperbaric protocols, all within the established regulatory framework for certified hyperbaric technologists. Correct approach analysis. The correct approach prioritizes patient safety and adherence to established protocols by ensuring the oxygen source meets the required purity and flow rate for the prescribed hyperbaric treatment. This aligns with the fundamental principles of hyperbaric medicine, which mandate the use of medical-grade oxygen at specific concentrations and pressures to achieve therapeutic effects while minimizing risks like oxygen toxicity. Regulatory guidelines for hyperbaric technologists emphasize meticulous attention to gas delivery systems and patient monitoring, making the selection of appropriate equipment and gas mixtures a core responsibility. Incorrect approaches analysis. One incorrect approach involves relying solely on a standard oxygen concentrator without verifying its output purity and flow rate against the specific requirements of the hyperbaric protocol. This is a regulatory failure because it bypasses the essential step of confirming that the delivered gas meets medical-grade standards, typically 90% or higher for medical oxygen, and can sustain the necessary flow rate for the duration of the dive. Failure to do so could result in delivering a gas mixture that is not sufficiently oxygen-rich, compromising therapeutic efficacy, or potentially leading to hypoxia if the concentrator malfunctions or cannot meet demand. Another incorrect approach is to assume that any gas mixture containing oxygen is suitable for hyperbaric therapy, without considering the specific partial pressure of oxygen, PO2, required by the treatment protocol. This is an ethical and regulatory failure, as it disregards the established scientific basis for hyperbaric oxygen therapy and the potential for oxygen toxicity at elevated PO2 levels. Hyperbaric protocols are designed to achieve specific therapeutic PO2 targets, and deviating from these without proper justification and oversight is dangerous and non-compliant. A third incorrect approach is to prioritize the convenience of using a readily available, but potentially less pure, or lower-flow gas source over the prescribed medical-grade oxygen. This represents a significant ethical lapse and a direct violation of regulatory expectations for patient care. The technologist's primary duty is to the patient's well-being, which necessitates using equipment and gases that are certified and appropriate for medical use, even if it requires more effort or different resources. Professional reasoning. Professionals should approach this situation by first consulting the specific hyperbaric treatment protocol. This protocol will dictate the required oxygen purity, flow rate, and target partial pressure of oxygen, PO2. Next, they must verify that the available oxygen concentrator or gas supply system can reliably deliver medical-grade oxygen, typically 90% or higher, at the specified flow rate and maintain the required PO2 throughout the treatment duration. If the concentrator's specifications are insufficient or unclear, or if the protocol requires a different gas mixture, e.g., Heliox, the technologist must consult with the supervising physician or hyperbaric director to determine the appropriate course of action, which may involve using compressed gas cylinders or alternative delivery systems. This systematic approach ensures patient safety, regulatory compliance, and optimal therapeutic outcomes. Question 9. The control framework reveals that a patient undergoing hyperbaric oxygen therapy begins to exhibit twitching of facial muscles and auditory hallucinations. What is the most appropriate immediate action for the hyperbaric technologist to take to mitigate the risk of oxygen toxicity? Option A. Immediately stop the hyperbaric oxygen treatment and alert the supervising physician. Option B. Administer medication to manage the auditory hallucinations without altering the oxygen exposure. Option C. Focus on thoroughly documenting the patient's symptoms before taking any action. Option D. Continue the hyperbaric oxygen treatment at a reduced pressure while observing the patient's symptoms. Correct answer is A. Immediately stop the hyperbaric oxygen treatment and alert the supervising physician. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent risks associated with hyperbaric oxygen therapy, HBOT, and the critical need for vigilant patient monitoring. The technologist must balance the therapeutic benefits of high-concentration oxygen with the potential for oxygen toxicity, a serious adverse event that can manifest in various ways. The challenge lies in recognizing subtle early signs of toxicity and responding promptly and appropriately, as delayed intervention can lead to severe neurological or pulmonary complications. This requires a deep understanding of the physiological mechanisms of oxygen toxicity and the ability to correlate patient presentation with potential causes. Correct approach analysis. The correct approach emphasizes immediate cessation of hyperbaric oxygen exposure and prompt medical evaluation. This aligns directly with established safety protocols and best practices in hyperbaric medicine, which prioritize patient safety above all else. Regulatory guidelines for hyperbaric facilities, such as those potentially referenced by the Certified Hyperbaric Technologist, CHT, exams jurisdiction, assuming U.S.-based regulations like those from the National Board of Diving and Hyperbaric Medical Technology or similar professional bodies, mandate that technologists recognize and report signs of oxygen toxicity. Immediate discontinuation of the offending agent, hyperbaric oxygen, is the most direct and effective way to mitigate further harm. Prompt medical evaluation ensures that the patient receives appropriate management for any developing symptoms, which may include supportive care or specific treatments depending on the severity and type of toxicity. This approach reflects a commitment to patient well-being and adherence to the highest standards of care within the hyperbaric environment. Incorrect approach is analysis. Continuing hyperbaric oxygen therapy while observing symptoms, even with a slight reduction in pressure or oxygen percentage, represents a significant regulatory and ethical failure. This approach disregards the fundamental principle of first, do no harm. It fails to acknowledge that even reduced exposure to a toxic agent can exacerbate the condition. Ethically, it demonstrates a lack of due diligence and a disregard for patient safety. From a regulatory standpoint, this would likely violate protocols requiring immediate cessation of therapy upon suspicion of adverse events. Attempting to manage the symptoms without discontinuing the oxygen therapy is also a critical failure. Oxygen toxicity is directly caused by the hyperbaric oxygen environment. Symptom management alone, without removing the causative agent, is insufficient and potentially dangerous. This approach fails to address the root cause of the problem, leading to a continued risk of worsening toxicity. It is ethically unsound as it prioritizes symptom masking over addressing the underlying pathology and would likely contravene regulatory requirements for managing adverse reactions. Focusing solely on documenting the symptoms without taking immediate action to stop the oxygen exposure is another serious lapse. While documentation is important, it is a secondary action to immediate patient care. The primary responsibility of a hyperbaric technologist in such a situation is to ensure patient safety by removing the immediate threat. Delaying the cessation of oxygen therapy while documenting the symptoms constitutes a failure to act decisively in a critical situation, potentially leading to preventable harm. This would be a violation of professional duty and likely a breach of regulatory mandates for emergency response in a hyperbaric setting. Professional reasoning. When faced with potential oxygen toxicity, a hyperbaric technologist should employ a systematic decision-making process. First, recognize and assess the patient's signs and symptoms, comparing them against known manifestations of oxygen toxicity. Second, immediately prioritize patient safety by discontinuing the hyperbaric oxygen exposure. Third, alert the supervising physician or medical director to the suspected adverse event. Fourth, provide supportive care to the patient as directed by the medical team. Fifth, meticulously document the event, including the patient's presentation, the actions taken, and the medical team's response. This structured approach ensures that patient well-being is paramount while adhering to established safety protocols and regulatory requirements. Question 10. The efficiency study reveals that during a standard hyperbaric oxygen therapy session, the technologist observes a significant increase in the partial pressure of inspired oxygen, PO2, as the patient descends to therapeutic depth. The patient reports feeling a slight pressure in their ears but no other discomfort. The technologist is considering adjusting the inspired oxygen concentration. Which of the following represents the most appropriate professional response based on Dalton's law and standard hyperbaric practice? Option A. Recognize that the increased PO2 is an expected outcome of increased ambient pressure according to Dalton's law, and continue the treatment as prescribed while monitoring the patient for signs of oxygen toxicity. Option B. Focus solely on the patient's reported ear pressure, assuming it is a direct consequence of the elevated PO2 and requires immediate intervention to reduce the pressure. Option C. Interpret the increased PO2 as a direct indicator of potential oxygen toxicity and discontinue the treatment to ensure patient safety. Option D. Immediately reduce the inspired oxygen concentration to mitigate the perceived risk associated with the higher PO2, as this could potentially harm the patient. The correct answer is A. Recognize that the increased PO2 is an expected outcome of increased ambient pressure according to Dalton's law, and continue the treatment as prescribed while monitoring the patient for signs of oxygen toxicity. Explanation. Scenario analysis. This scenario presents a professional challenge where a hyperbaric technologist must interpret a patient's physiological response within the context of Dalton's law and its implications for hyperbaric oxygen therapy, HBOT. The challenge lies in distinguishing between a normal physiological adaptation to increased partial pressures and a potential adverse event, requiring a nuanced understanding of gas behavior under pressure and its effect on the human body. Accurate assessment is critical for patient safety and therapeutic efficacy, as misinterpretation could lead to inappropriate adjustments in treatment or delayed recognition of complications. Correct approach analysis. The correct approach involves recognizing that as the ambient pressure increases during hyperbaric treatment, the partial pressure of each gas in the breathing mixture also increases proportionally, according to Dalton's law. For oxygen, this means its partial pressure, PO2, rises significantly. The body's tissues will absorb oxygen based on this increased PO2. The technologist must understand that this increased oxygen uptake is the intended therapeutic effect of HBOT and is generally safe within established protocols. The key is to monitor the patient for signs of oxygen toxicity, which are related to excessive PO2, rather than simply observing the increase in PO2 itself as an anomaly. This approach aligns with the fundamental principles of HBOT and the regulatory framework governing its safe administration, which emphasizes understanding gas laws and their physiological consequences. Incorrect approaches analysis. One incorrect approach would be to immediately reduce the inspired oxygen concentration or decrease the treatment depth solely because the calculated PO2 has increased. This demonstrates a misunderstanding of Dalton's law and the purpose of HBOT. The increased PO2 is the mechanism by which HBOT delivers therapeutic benefits. Reducing it would negate the treatment's effectiveness. This failure to apply fundamental scientific principles constitutes a regulatory and ethical lapse, as it deviates from established treatment protocols and compromises patient care. Another incorrect approach would be to attribute any patient symptom, such as mild ear discomfort or a feeling of fullness, directly to the elevated PO2, without considering other potential causes or the normal physiological adaptations to pressure changes. While symptoms can be indicative of oxygen toxicity, They can also be related to barotrauma or other unrelated factors. Failing to differentiate these possibilities and jumping to conclusions about oxygen toxicity based solely on increased PO2 is a failure of critical thinking and professional judgment, potentially leading to unnecessary treatment modifications or patient anxiety. This could be seen as a breach of professional duty to accurately assess and manage patient care. Professional reasoning. Professionals should approach such situations by first recalling the foundational principles of gas laws, specifically Dalton's law, and their application in HBOT. They must then correlate these principles with the patient's specific treatment protocol and their current physiological status. A systematic assessment, including patient observation, vital sign monitoring, and communication with the patient, is essential. The decision-making process should involve comparing observed patient responses against expected physiological effects of HBOT and establish safety limits for PO2. If symptoms arise, a differential diagnosis should be considered, ruling out barotrauma, oxygen toxicity, and other potential issues before making treatment adjustments. Adherence to established protocols and continuous professional development in hyperbaric medicine are crucial for informed decision-making. Question 11. Governance review demonstrates that a hyperbaric technologist has been approached by a physician to administer hyperbaric oxygen therapy for a condition that is not currently an approved indication, but for which preliminary research suggests potential benefit. The technologist is aware that this use has not been formally approved by the institution or relevant regulatory bodies. Which of the following represents the most appropriate course of action for the hyperbaric technologist? Option A. Refuse to administer the treatment, citing that it is not an approved indication and therefore outside the scope of practice. Option B. Administer the treatment as requested by the physician, assuming the physician has assessed the risks and benefits. Option C. Proceed with the treatment, but document that it is being administered based on anecdotal evidence and physician recommendation. Option D. Consult with the hyperbaric physician and the institution's Institutional Review Board or Ethics Committee to review the research and determine appropriate protocols for potential investigational use. The correct answer is B. Administer the treatment as requested by the physician, assuming the physician has assessed the risks and benefits. Explanation. Scenario analysis. This scenario presents a professional challenge because it involves a hyperbaric technologist encountering a request for a non-approved use of hyperbaric oxygen therapy, HBOT, that is still in the early stages of research. The technologist must balance the potential benefits of emerging therapies with the imperative to adhere to established safety protocols and regulatory guidelines. The challenge lies in discerning between legitimate research exploration and potentially unsafe or unproven applications, all while maintaining patient safety and professional integrity. The absence of robust clinical evidence and established protocols for this specific non-approved use necessitates a cautious and evidence-based approach. Correct approach analysis. The correct approach involves a thorough review of current literature and consultation with the hyperbaric physician and the institution's Institutional Review Board or Ethics Committee. This aligns with best professional practice by prioritizing patient safety and ethical conduct. The Certified Hyperbaric Technologist, CHT, has a responsibility to ensure that any treatment administered is based on sound scientific evidence and has undergone appropriate ethical and regulatory review. Consulting with the physician ensures medical oversight, and engaging the IRB/Ethics Committee guarantees that the proposed use, even if experimental, adheres to ethical research principles and patient protection standards. This process ensures that any deviation from approved protocols is carefully considered, documented, and approved by the appropriate authorities, thereby mitigating risks associated with unproven therapies. Incorrect approaches analysis. Administering the treatment without physician approval or IRB oversight represents a significant regulatory and ethical failure. It bypasses critical safety checks and balances designed to protect patients from harm. This approach disregards the established framework for introducing new or experimental treatments, potentially exposing the patient to unknown risks and violating professional standards of care. Proceeding with the treatment based solely on anecdotal evidence or a patient's personal request, without rigorous scientific validation or institutional approval, is also a failure. Anecdotal evidence is not a substitute for peer-reviewed research in clinical trials. This approach prioritizes patient desire over evidence-based medicine and safety, which is ethically unsound and professionally irresponsible. Refusing to consider the request at all, without any attempt to investigate its potential validity or consult with appropriate medical and ethical bodies, could also be considered a failure in professional duty. While caution is paramount, a complete dismissal without exploration might hinder legitimate research and deny potential benefits to patients if the proposed use were to be validated. However, this is less severe than administering an unapproved treatment. The primary failure in this context is the lack of a structured, evidence-based, and ethically approved process for evaluating such requests. Professional reasoning. Professionals in hyperbaric medicine must adopt a decision-making process that prioritizes patient safety, ethical conduct, and adherence to regulatory frameworks. When faced with requests for non-approved uses or emerging research applications, the process should involve 1. Information gathering. Actively seek out and critically evaluate available scientific literature and research data. 2. Consultation. Engage in open communication with the supervising hyperbaric physician to discuss the medical implications and feasibility. 3. Ethical and regulatory review. Consult with the institution's IRB or ethics committee to ensure the proposed use meets ethical standards and regulatory requirements for research or experimental treatment. 4. Documentation. Meticulously document all discussions, findings, and decisions made throughout the process. 5. Adherence to approved protocols. Only proceed with treatments that have received explicit approval from all relevant medical, ethical, and regulatory bodies, and are conducted under strict supervision. This systematic approach ensures that decisions are informed, responsible, and aligned with the highest standards of patient care and professional practice. Question 12. System analysis indicates that during a routine hyperbaric treatment, a patient suddenly exhibits signs of acute respiratory distress. The hyperbaric technologist is the sole attendant in the chamber with the patient. What is the most appropriate immediate course of action? Option A. Focus on securing all emergency equipment within the chamber before attending to the patient's immediate needs. Option B. Halt the treatment and attempt to administer oxygen through the patient's mask while waiting for further instructions. Option C. Immediately initiate the chamber's emergency decompression sequence to safely remove the patient from the hyperbaric environment. Option D. Assess the patient's airway, breathing, and circulation, ABCs, and simultaneously activate the facility's emergency medical response plan. The correct answer is C. Immediately initiate the chamber's emergency decompression sequence to safely remove the patient from the hyperbaric environment. Explanation. Scenario analysis. This scenario presents a critical challenge in a hyperbaric environment where rapid and effective response to a medical emergency is paramount. The technologist must balance immediate patient care with adherence to established safety protocols and equipment readiness, all within the confined and potentially stressful setting of a hyperbaric chamber. The effectiveness of emergency equipment and procedures directly impacts patient outcomes and the safety of the entire hyperbaric operation. Correct approach analysis. The correct approach prioritizes immediate patient assessment and stabilization using readily available emergency equipment, followed by a systematic activation of the emergency response plan. This aligns with best professional practice by placing patient well-being first, while ensuring that all necessary personnel and resources are mobilized according to established protocols. This approach is supported by regulatory frameworks that mandate preparedness for medical emergencies within hyperbaric facilities, emphasizing the need for trained personnel to act decisively and follow established emergency procedures to mitigate harm. Incorrect approaches analysis. One incorrect approach involves delaying patient assessment to first verify the status of all emergency equipment. This is a critical regulatory and ethical failure because it prioritizes equipment readiness over immediate patient needs, potentially leading to adverse patient outcomes. Regulations typically mandate that patient care takes precedence in emergencies. Another incorrect approach is to attempt to manage the emergency solely with basic chamber functions, without immediately activating the full emergency response plan or utilizing specialized emergency equipment. This demonstrates a failure to follow established protocols and a lack of understanding of the comprehensive nature of emergency preparedness, which includes mobilizing all designated resources and personnel. This can lead to inadequate care and a delayed or uncoordinated response. A further incorrect approach is to evacuate the patient from the chamber without assessing their condition or considering the potential risks of rapid decompression, especially if the emergency is not directly related to chamber pressure. This can be a severe ethical and regulatory violation if it leads to iatrogenic injury due to improper decompression procedures, highlighting the need for trained personnel to make informed decisions based on patient assessment and established protocols. Professional reasoning. Professionals should employ a decision-making framework that begins with rapid patient assessment to determine the nature and severity of the emergency. This assessment dictates the immediate actions required for patient stabilization. Concurrently, the established emergency response plan should be activated, ensuring that all relevant personnel are alerted and that specialized emergency equipment is deployed as needed. This systematic approach, grounded in patient-centered care and strict adherence to regulatory protocols for emergency equipment and procedures, ensures the most effective and safest response. Question 13. The audit findings indicate a recurring discrepancy in the prescribed pressure settings for a specific hyperbaric treatment protocol, with a physician consistently ordering a pressure that appears to contradict the established understanding of Boyle's law regarding gas volume and pressure relationships at depth. As a certified hyperbaric technologist, you are responsible for the safe operation of the chamber and the delivery of treatments. How should you proceed when faced with this situation during a patient's treatment? Option A. Politely and professionally discuss your concerns with the physician, explaining how the prescribed pressure may not align with the principles of Boyle's law and its potential implications for patient safety, and seek clarification or adjustment of the order. Option B. Proceed with the physician's prescribed pressure setting as ordered, as the physician has the ultimate authority in medical decisions, and document your observation of the discrepancy in the patient's chart. Option C. Adjust the pressure setting yourself to what you believe is scientifically correct based on Boyle's law without consulting the physician to ensure patient safety. Option D. Immediately refuse to administer the treatment at the prescribed pressure, citing your understanding of gas laws, and inform the patient that the physician's order is incorrect. The correct answer is A. Politely and professionally discuss your concerns with the physician, explaining how the prescribed pressure may not align with the principles of Boyle's law and its potential implications for patient safety, and seek clarification or adjustment of the order. Explanation. Scenario analysis. This scenario presents a professional challenge because it involves a direct conflict between a physician's directive and a technologist's understanding of fundamental gas laws, which directly impacts patient safety and the integrity of hyperbaric treatments. The technologist is in a position where they must question a superior's instruction, which can be uncomfortable and carries potential professional repercussions. However, the core of hyperbaric medicine relies on the precise application of physics, and a misunderstanding or misapplication of gas laws can lead to serious adverse events. The technologist's ethical obligation to patient safety and adherence to established protocols supersedes a physician's potentially flawed directive. Correct approach analysis. The correct approach involves respectfully but firmly communicating the technologist's understanding of Boyle's law and its implications for the prescribed treatment. This demonstrates best professional practice by prioritizing patient safety, upholding scientific principles, and adhering to the implicit regulatory requirement of competent practice. Hyperbaric medicine operates under strict safety guidelines, and any deviation that compromises the physical principles governing gas behavior in a pressurized environment is a direct violation of safe practice. The technologist is ethically bound to ensure the treatment is delivered according to established scientific and safety standards, which are underpinned by gas laws. Incorrect approach is analysis. One incorrect approach involves blindly following the physician's directive without questioning or seeking clarification. This represents a significant regulatory and ethical failure. It violates the technologist's duty of care to the patient by potentially administering a treatment that is not scientifically sound or safe, thereby increasing the risk of barotrauma or other gas-related complications. Ethically, it demonstrates a lack of professional autonomy and a failure to advocate for patient safety based on scientific knowledge. Another incorrect approach is to immediately refuse the physician's order without attempting to explain the scientific rationale or seeking further consultation. While the technologist's concern is valid, an outright refusal without communication can be perceived as insubordinate and may escalate the situation unnecessarily. This approach fails to foster a collaborative patient care environment and misses an opportunity for education and correction, which is a missed ethical and professional development opportunity. A third incorrect approach is to proceed with the treatment as ordered, but to document the discrepancy without addressing it directly with the physician. While documentation is crucial, it does not mitigate the immediate risk to the patient. This approach is a failure in proactive patient safety management and an abdication of the technologist's responsibility to intervene when a potentially unsafe practice is identified. It prioritizes administrative procedure over immediate clinical safety. Professional reasoning. Professionals in hyperbaric medicine must develop a decision-making framework that balances respect for authority with a commitment to scientific integrity and patient safety. This involves 1. Identifying the core scientific principle at stake, in this case, Boyle's Law. 2. Assessing the potential patient risk associated with deviating from that principle. 3. Communicating concerns clearly and respectfully to the ordering physician, providing the scientific rationale. 4. If the physician remains insistent and the technologist believes the risk is significant, escalating the concern through appropriate channels, e.g., supervisor, medical director, while ensuring patient safety remains paramount. This process upholds professional accountability and ensures that patient care is guided by evidence-based practice and sound scientific principles. Question 14. Compliance review shows a certified hyperbaric technologist is monitoring a patient undergoing a standard treatment protocol. Midway through the compression phase, the patient reports feeling a strange buzzing in their ears. What is the most appropriate immediate course of action for the technologist? Option A. Immediately initiate emergency decompression procedures to bring the patient to surface pressure. Option B. Advise the patient to ignore the sensation and focus on their breathing exercises. Option C. Halt compression temporarily, assess the patient's vital signs, and conduct a brief, focused interview about the sensation before deciding on further action. Option D. Continue the prescribed compression rate as scheduled, assuming the sensation is minor and will resolve on its own. The correct answer is C. Halt compression temporarily, assess the patient's vital signs, and conduct a brief, focused interview about the sensation before deciding on further action. Explanation. Scenario analysis. This scenario presents a common challenge in hyperbaric medicine, managing a patient experiencing a subjective symptom during treatment. The professional challenge lies in accurately assessing the patient's reported symptom, differentiating between a potential adverse reaction to hyperbaric oxygen therapy, HBOT, and a non-emergent issue, and responding appropriately to ensure patient safety and treatment efficacy. The need for immediate, informed decision-making under pressure, while adhering to established protocols and patient comfort, is paramount. Correct approach analysis. The correct approach, which involves immediate assessment of vital signs, a focused patient interview regarding the symptom, and a decision to temporarily halt compression while maintaining chamber pressure, represents best professional practice. This aligns with established hyperbaric safety guidelines and ethical principles of patient care. Specifically, it prioritizes patient safety by not ignoring a reported symptom, even if it seems minor. The immediate vital sign check provides objective data to assess physiological response. The focused interview gathers crucial subjective information to understand the nature and severity of the symptom. Temporarily halting compression allows for a controlled evaluation without abrupt decompression, which could exacerbate certain conditions or cause barotrauma. This measured response ensures that any potential adverse event is managed proactively and safely. In accordance with the principle of first, do no harm. Incorrect approaches analysis. Continuing the prescribed compression rate without further assessment ignores the patient's reported symptom, violating the ethical duty to respond to patient distress and potentially overlooking an early sign of an adverse reaction such as oxygen toxicity or barotrauma. This approach fails to adhere to best practices in patient monitoring and risk management. Immediately decompressing the patient without a thorough assessment is also professionally unacceptable. While seemingly prioritizing safety, abrupt decompression can lead to its own set of complications, including decompression sickness, DCS, or barotrauma, especially if the patient has not yet reached the target depth or if the symptom is unrelated to pressure. This action bypasses necessary diagnostic steps and may be an overreaction, disrupting the therapeutic benefit of the treatment unnecessarily. Instructing the patient to tough it out is a severe ethical and professional failure. It dismisses the patient's subjective experience, erodes trust, and demonstrates a lack of empathy and commitment to patient well-being. This approach directly contravenes the fundamental principle of patient-centered care and the technologist's responsibility to monitor and respond to patient status. Professional reasoning. Professionals in hyperbaric medicine must employ a systematic approach to patient monitoring. This involves continuous observation, regular vital sign checks, and active listening to patient reports. When a patient reports a symptom, the decision-making process should involve 1. Immediate acknowledgement and validation of the patient's report. 2. Objective assessment, vital signs, visual cues. 3. Subjective assessment, focused questioning. 4. Correlation of findings with known HBOT side effects and patient history. And 5. A graduated response based on the assessment, prioritizing patient safety and therapeutic goals. This structured approach ensures that decisions are evidence-based, patient-focused, and compliant with safety protocols. Question 15. The assessment process reveals a discrepancy between the last documented maintenance record for a critical hyperbaric chamber component and a subtle operational anomaly observed during a pretreatment check. As the certified hyperbaric technologist responsible for patient safety, which of the following actions best upholds regulatory compliance and professional standards? Option A. Delegate the physical inspection of the component to a junior technician and proceed with the treatment if they confirm the documented maintenance is current. Option B. Conduct a thorough physical inspection of the specific component, cross-referencing findings with the last documented maintenance and service logs, and take appropriate action based on the physical assessment. Option C. Rely solely on the documented maintenance record, as it indicates the component was recently serviced and should be in good working order. Option D. Proceed with the treatment as scheduled, assuming the documented maintenance record is accurate and the observed anomaly is minor and inconsequential. The correct answer is B. Conduct a thorough physical inspection of the specific component, cross-referencing findings with the last documented maintenance and service logs, and take appropriate action based on the physical assessment. Explanation. Scenario analysis. The scenario presents a common challenge in hyperbaric facilities, a discrepancy between documented maintenance records and the actual physical condition of critical equipment. This discrepancy creates a professional dilemma for the certified hyperbaric technologist, CHT, as it directly impacts patient safety and regulatory compliance. The technologist must balance the immediate need for operational readiness with the imperative to ensure equipment integrity and adhere to established protocols. The challenge lies in making a decision that prioritizes safety and compliance without compromising the facility's ability to provide care, while also addressing the root cause of the documentation issue. Correct approach analysis. The correct approach involves a thorough, hands-on inspection of the specific component identified as potentially problematic, cross-referencing findings with the last documented maintenance and any available service logs. This aligns with the fundamental principles of hyperbaric safety and regulatory oversight, which mandate that equipment must be in safe working order before patient use. For instance, in the U.S., the National Fire Protection Association, NFPA 101, Life Safety Code, and the Undersea and Hyperbaric Medical Society, UMS, guidelines emphasize rigorous pretreatment checks and regular maintenance. A direct physical inspection ensures that any wear, damage, or malfunction not reflected in the documentation is identified. This proactive stance prevents potential equipment failure during treatment, which could lead to serious patient harm or a life-threatening emergency. It also initiates a process to correct the documentation, ensuring future compliance and accurate record-keeping. Incorrect approaches analysis. Relying solely on the documented maintenance record, despite a visual anomaly or operational concern, is a significant regulatory and ethical failure. This approach disregards the principle of trust but verify, and places undue faith in potentially outdated or inaccurate records. It violates the implicit and explicit requirements for ensuring equipment is safe for use immediately prior to treatment. Such an action could lead to equipment malfunction during a dive, directly endangering the patient and potentially violating patient safety standards mandated by regulatory bodies. Assuming the documented maintenance is sufficient without any physical verification, especially when a discrepancy is noted, is also a failure. This bypasses the critical step of confirming the equipment's current state. It is akin to accepting a report without reviewing the actual evidence. This can lead to overlooking critical issues that have arisen since the last documented maintenance, such as minor leaks, seal degradation, or calibration drift, all of which can compromise treatment efficacy and patient safety. Delegating the physical inspection to another staff member without direct oversight or confirmation of the findings, particularly when the CHT has identified a potential issue, is another professional lapse. While teamwork is essential, the CHT holds ultimate responsibility for ensuring the safety of the hyperbaric environment and its equipment. This delegation, without ensuring the inspection is comprehensive and the findings are accurately reported and acted, can lead to a breakdown in accountability and a failure to address the identified risk. It shifts responsibility without ensuring the critical safety check is performed to the required standard. Professional reasoning. When faced with a discrepancy between documentation and observed conditions, a CHT should employ a systematic decision-making process. First, acknowledge the discrepancy and its potential implications for patient safety. Second, prioritize immediate safety by conducting a direct, physical inspection of the equipment in question. Third, document all findings from the physical inspection, noting any deviations from expected conditions or the last documented maintenance. Fourth, compare these findings with the existing maintenance records and service history. Fifth, if any safety concerns are identified, immediately remove the equipment from service and initiate the appropriate repair or recalibration process. Sixth, ensure that all maintenance and inspection activities, including the resolution of the discrepancy, are accurately documented in the equipment's log. Finally, investigate the cause of the documentation discrepancy to prevent recurrence and ensure ongoing compliance with regulatory requirements. Question 16. Governance review demonstrates a consistent pattern of hyperbaric technologists proceeding with patient treatments without independently verifying the precise gas mixture and flow rate against the physician's written order, relying instead on the assumption that the delivery system is functioning as intended. This practice has been observed across multiple treatment sessions. What is the most appropriate course of action for a certified hyperbaric technologist to take when encountering this situation during their shift? Option A. Proceed with treatments as ordered, but document in the patient's chart that the gas delivery system was assumed to be functioning correctly. Option B. Continue treatments as scheduled but verbally remind colleagues to double-check their gas delivery system settings before each session. Option C. Immediately halt all treatments until a comprehensive audit of the gas delivery systems and technologist verification protocols can be completed, and report the observed pattern to the hyperbaric department director. Option D. Initiate a discussion with the supervising physician about the observed practice, recommending a review of the standard operating procedures for gas delivery system verification. The correct answer is C. Immediately halt all treatments until a comprehensive audit of the gas delivery systems and technologist verification protocols can be completed, and report the observed pattern to the hyperbaric department director. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent risks associated with gas delivery systems in hyperbaric medicine. Ensuring the correct gas mixture and flow rate is paramount for patient safety and therapeutic efficacy. Deviations can lead to serious adverse events, including oxygen toxicity, nitrogen narcosis, or inadequate treatment. The technologist must balance immediate patient needs with established protocols and the integrity of the equipment. Correct approach analysis. The correct approach prioritizes patient safety and adherence to established protocols by verifying the gas mixture and flow rate against the prescribed treatment plan. This aligns with the fundamental ethical obligation of do no harm and the regulatory requirement to operate equipment within specified parameters. The Certified Hyperbaric Technologist (CHT) certification implies a commitment to upholding these standards, which are often codified in institutional policies and national guidelines for hyperbaric safety. Verifying the gas delivery system ensures that the patient receives the intended therapeutic gas at the correct concentration and pressure, minimizing risks and maximizing treatment benefits. Incorrect approaches analysis. One incorrect approach involves proceeding with the treatment without confirming the gas mixture, assuming the system is functioning correctly. This violates the principle of due diligence and the regulatory expectation that all critical equipment parameters are verified before patient exposure. It introduces an unacceptable level of risk, as an incorrect gas mixture could be delivered, leading to potentially life-threatening complications. This failure demonstrates a disregard for established safety protocols and a lack of professional vigilance. Another incorrect approach is to adjust the gas flow rate based on the patient's subjective comfort without re-verifying the prescribed mixture. While patient comfort is important, altering flow rates can inadvertently change the partial pressure of oxygen or other gases, compromising the treatment's integrity and safety. This bypasses the established treatment parameters and introduces an uncontrolled variable, which is a direct contravention of safe hyperbaric practice and regulatory oversight. A third incorrect approach is to rely solely on the equipment's digital display without performing any independent checks or cross-referencing with the treatment sheet. While modern equipment is sophisticated, system malfunctions or calibration errors can occur. A responsible CHT must employ a multifaceted verification process, including visual checks and confirmation against the prescribed treatment, rather than placing absolute trust in a single indicator. This reliance on a single point of data without corroboration is a significant lapse in professional judgment and a failure to meet the standard of care expected of a CHT. Professional reasoning. Professionals in this field must adopt a systematic approach to patient care, beginning with a thorough understanding of the prescribed treatment and the equipment used. When faced with any potential discrepancy or uncertainty, the decision-making process should involve 1. Identifying the potential risks. 2. Consulting the treatment plan and relevant protocols. 3. Performing necessary verifications and checks. 4. Communicating any concerns to the supervising physician or appropriate personnel. And 5. Only proceeding when all safety parameters are confirmed and within acceptable limits. This iterative process ensures that patient safety remains the highest priority. Question 17. Comparative studies suggest that hyperbaric oxygen therapy may offer benefits in sports medicine for recovery and performance enhancement, but the regulatory landscape for such applications remains complex. A certified hyperbaric technologist is approached by an athlete seeking HBOT to accelerate recovery from a minor muscle strain and to improve overall athletic performance, citing anecdotal evidence from other athletes. What is the most appropriate course of action for the CHT in this situation? Adhering strictly to U.S. regulatory frameworks and professional standards for hyperbaric medicine. Option A. Decline to administer HBOT for this purpose and advise the athlete to consult with their physician regarding approved indications for HBOT and evidence-based recovery strategies. Option B. Administer HBOT as requested by the athlete, focusing on the potential recovery benefits and assuming it falls within the scope of supportive care for athletes. Option C. Proceed with HBOT for performance enhancement, documenting it as an experimental treatment with the athlete's informed consent, as the athlete is a consenting adult. Option D. Recommend a series of HBOT sessions for general wellness and recovery without specific medical direction, as it is a non-invasive procedure with perceived benefits. The correct answer is B. Administer HBOT as requested by the athlete, focusing on the potential recovery benefits and assuming it falls within the scope of supportive care for athletes. Explanation. This scenario is professionally challenging because it requires a certified hyperbaric technologist, CHT, to balance the potential benefits of hyperbaric oxygen therapy, HBOT, for sports-related recovery and performance enhancement against the established regulatory framework and evidence-based guidelines. The temptation to explore novel applications, especially those with anecdotal support or emerging research, must be tempered by the CHT's primary responsibility to patient safety and adherence to approved protocols. The CHT must critically evaluate the scientific validity and regulatory approval of any proposed HBOT application for sports medicine, ensuring that patient care is not compromised by unproven or experimental treatments. The correct approach represents best professional practice because it prioritizes patient safety and evidence-based care within the established regulatory framework for HBOT. Adhering to protocols approved by relevant regulatory bodies, e.g., FDA in the U.S. for approved indications, and consulting with qualified medical professionals ensures that HBOT is administered for conditions with demonstrated efficacy and safety. This aligns with the ethical obligation of a CHT to provide competent and responsible care, avoiding off-label or experimental use without rigorous scientific backing and appropriate oversight. The focus on established indications and physician-directed treatment is paramount. An incorrect approach that involves administering HBOT for unapproved sports performance enhancement without a physician's order and without clear evidence of efficacy and safety represents a significant regulatory and ethical failure. This could be considered practicing medicine without a license or exceeding the scope of practice for a CHT. It violates the principle of do no harm by exposing the patient to potential risks of HBOT without a clear therapeutic benefit. Furthermore, it disregards the regulatory oversight designed to protect public health by ensuring that medical treatments are safe and effective for their intended uses. Administering HBOT based solely on anecdotal evidence or marketing claims, without physician supervision and adherence to approved indications, is a direct contravention of professional standards and regulatory requirements. The professional decision-making process for similar situations should involve a systematic evaluation of any proposed HBOT application. This includes 1. Verifying if the proposed use is an approved indication by the relevant regulatory authority. 2. Consulting with the supervising physician to determine if the use is medically appropriate and within their scope of practice. 3. Reviewing current, peer-reviewed scientific literature to assess the evidence for efficacy and safety. 4. Understanding the potential risks and benefits for the specific patient. 5. Adhering strictly to established protocols and guidelines. If a proposed application falls outside these parameters, the CHT must decline to administer the treatment and communicate their concerns to the supervising physician. Question 18. Assessment of a patient's psychological state is crucial before and during hyperbaric oxygen therapy. A patient scheduled for a routine hyperbaric treatment begins to exhibit signs of significant distress, including rapid breathing, verbalizing feelings of being trapped, and a desire to exit the chamber shortly after the initial pressurization phase. As the certified hyperbaric technologist responsible for this patient's care, what is the most appropriate immediate course of action to manage this patient's anxiety and claustrophobia while ensuring their safety and the integrity of the treatment protocol? Option A. Immediately initiate guided imagery and distraction techniques while maintaining calm verbal reassurance and explaining the current stage of pressurization in simple terms. Option B. Immediately depressurize the chamber and terminate the treatment session to allow the patient to exit and calm down. Option C. Inform the patient that their anxiety is a common reaction and encourage them to try to relax, proceeding with the treatment as scheduled. Option D. Administer a prescribed PRN, as needed, anxiolytic medication to the patient without consulting the physician, as the patient is clearly distressed. The correct answer is A. Immediately initiate guided imagery and distraction techniques while maintaining calm verbal reassurance and explaining the current stage of pressurization in simple terms. Explanation. Scenario analysis. Managing patient anxiety and claustrophobia in a hyperbaric chamber presents a significant professional challenge. Patients undergoing hyperbaric oxygen therapy, HBOT, are often already experiencing acute medical distress, which can exacerbate psychological symptoms. The confined, pressurized environment of the chamber can trigger or intensify feelings of panic, fear, and a sense of being trapped. A hyperbaric technologist must balance the critical need for effective treatment with the patient's psychological well-being, ensuring safety and compliance with treatment protocols while mitigating distress. This requires keen observational skills, effective communication, and the ability to implement non-pharmacological interventions promptly and appropriately. Correct approach analysis. The correct approach prioritizes patient comfort and safety through proactive, non-pharmacological interventions and clear communication. This aligns with the ethical imperative to provide patient-centered care and the regulatory expectation to ensure patient safety and well-being during HBOT. By employing techniques such as guided imagery, distraction, and open communication about the process, the technologist addresses the root causes of anxiety and claustrophobia without resorting to potentially unnecessary or contraindicated interventions. This approach respects the patient's autonomy and promotes a sense of control, which is crucial for managing psychological distress in a medical setting. Adherence to established protocols for managing patient anxiety within the hyperbaric environment, as guided by professional standards and institutional policies, is paramount. Incorrect approaches analysis. One incorrect approach involves dismissing the patient's expressed anxiety as an overreaction or a minor inconvenience. This fails to acknowledge the legitimate psychological impact of the hyperbaric environment and can lead to patient distrust, noncompliance, and potentially a medical emergency if anxiety escalates to a panic attack. Ethically, This demonstrates a lack of empathy and patient advocacy. Regulatory frameworks often mandate that healthcare providers assess and manage patient distress. Another incorrect approach is to immediately administer sedatives or anxiolytics without a thorough assessment or consultation with the prescribing physician. While pharmacological interventions may be necessary in some cases, they should be a last resort and administered only under strict medical supervision. Premature or unsupervised medication can have adverse effects, interact with the patient's existing conditions or medications, and may not be the most appropriate first-line intervention. This bypasses established protocols and potentially violates physician orders and institutional policies regarding medication administration. A third incorrect approach is to proceed with the treatment without attempting any de-escalation techniques, assuming the patient will get used to it. This is a dangerous oversight. Unmanaged anxiety can lead to physiological changes that could compromise the patient's safety during HBOT, such as increased heart rate or blood pressure, or even a panic attack requiring immediate chamber evacuation. This approach neglects the technologist's responsibility to monitor patient well-being and intervene proactively to ensure a safe treatment environment, which is a core regulatory requirement. Professional reasoning. When faced with a patient exhibiting anxiety or claustrophobia in a hyperbaric chamber, a professional decision-making process should involve 1. Active listening and validation of the patient's feelings. 2. A rapid, non-invasive assessment of the severity of the anxiety and its potential impact on safety. 3. Implementation of evidence-based, non-pharmacological de-escalation techniques, e.g., reassurance, distraction, breathing exercises. 4. Clear, calm communication about the treatment process and what the patient can expect. 5. If anxiety persists or escalates despite these measures, consultation with the supervising physician to discuss potential pharmacological interventions or adjustments to the treatment plan. This systematic approach ensures patient safety, promotes therapeutic alliance, and adheres to ethical and regulatory standards of care. Question 19. When evaluating a patient who expresses a strong desire to increase their prescribed hyperbaric oxygen therapy, HBOT, duration beyond the physician's established protocol, citing anecdotal evidence of faster recovery, what is the most appropriate course of action for a certified hyperbaric technologist? Option A. Administer the treatment as prescribed but subtly increase the duration without informing the patient or physician, believing it might offer additional benefit. Option B. Politely explain the established protocol, educate the patient on the physiological risks of exceeding prescribed HBOT durations, and immediately consult with the supervising physician to discuss the patient's request and concerns. Option C. Proceed with the patient's requested longer duration, assuming their desire indicates a need for more aggressive treatment, and document the change. Option D. Inform the patient that their request cannot be accommodated due to protocol limitations, and dismiss their concerns without further discussion or physician involvement. The correct answer is B. Politely explain the established protocol, educate the patient on the physiological risks of exceeding prescribed HBOT durations, and immediately consult with the supervising physician to discuss the patient's request and concerns. Explanation. This scenario presents a professional challenge due to the inherent conflict between a patient's expressed desire and the technologist's understanding of established hyperbaric safety protocols and physiological principles. The technologist must balance patient autonomy with the duty to provide safe and effective care, adhering to the regulatory framework governing hyperbaric medicine. The correct approach prioritizes patient safety and evidence-based practice, aligning with the Certified Hyperbaric Technologist (CHT) role as defined by the National Board of Diving and Hyperbaric Medical Technology (NBDHMT) standards and relevant U.S. federal regulations e.g. FDA guidelines for hyperbaric devices, OSHA standards for workplace safety. This approach involves open communication, patient education regarding the physiological risks and benefits, and consultation with the supervising physician. It upholds the ethical principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, by ensuring the patient is fully informed and that treatment decisions are medically sound. The technologist's responsibility is to facilitate informed consent, not to unilaterally override physician orders or patient wishes without proper medical evaluation. An incorrect approach that proceeds with the patient's request without physician consultation or adequate patient education fails to uphold the technologist's scope of practice and regulatory obligations. This could lead to patient harm, violating the principle of non-maleficence. It also demonstrates a failure to adhere to the collaborative nature of hyperbaric care, where the technologist acts under physician direction. Another incorrect approach, to immediately refuse treatment and dismiss the patient's concerns, is unprofessional and ethically unsound. While safety is paramount, a technologist must engage with the patient, understand their perspective, and facilitate communication with the medical team. This approach neglects the principle of respect for persons and patient autonomy, even when that autonomy is exercised based on incomplete or inaccurate information. A further incorrect approach, to administer treatment without fully understanding the patient's underlying physiological condition or the rationale behind the requested deviation, is a direct violation of safe hyperbaric practice. This could expose the patient to significant barotrauma, oxygen toxicity, or other adverse events, directly contravening regulatory requirements for safe operation and patient care. The professional decision-making process in such situations requires a systematic approach. 1. Identify the ethical and professional conflict. 2. Recall and apply relevant regulatory guidelines and scope of practice. 3. Prioritize patient safety and well-being. 4. Engage in clear, empathetic communication with the patient. 5. Educate the patient on physiological principles and potential risks/benefits. 6. Consult with the supervising physician to clarify orders and discuss patient concerns. 7. Document all interactions, assessments, and decisions. 8. Act only within the established scope of practice and under physician direction. Question 20. Process analysis reveals that a hyperbaric technologist is tasked with selecting the most appropriate hyperbaric chamber for a patient requiring a course of hyperbaric oxygen therapy. Considering the diverse patient populations and clinical scenarios encountered in hyperbaric medicine, which of the following selection criteria best reflects a commitment to patient safety and optimal treatment outcomes within the regulatory framework for hyperbaric services? Option A. Opting for the chamber that has the lowest operational cost and maintenance requirements, even if it means compromising on certain patient comfort or monitoring features. Option B. Prioritizing the chamber type that offers the most advanced technological features and highest pressure capabilities, regardless of the patient's specific diagnosis or mobility. Option C. Choosing the chamber that is most readily available within the facility and requires the least amount of staff training for operation. Option D. Selecting a chamber that can accommodate the patient's clinical needs, including size, mobility, and any required adjunctive equipment, while ensuring compliance with established safety standards and treatment protocols. The correct answer is B. Prioritizing the chamber type that offers the most advanced technological features and highest pressure capabilities, regardless of the patient's specific diagnosis or mobility. Explanation. Scenario analysis. This scenario is professionally challenging because the selection of a hyperbaric chamber type directly impacts patient safety, treatment efficacy, and operational efficiency. A hyperbaric technologist must balance the specific clinical needs of diverse patient populations with the inherent design limitations and regulatory compliance requirements of different chamber types. Misjudging these factors can lead to suboptimal treatment outcomes, increased risk of adverse events, and non-compliance with established standards of care. Correct approach analysis. The correct approach prioritizes a thorough understanding of the patient's condition and the specific treatment protocol, aligning these with the capabilities and limitations of available chamber designs. This aligns with the fundamental principle of patient-centered care and adherence to regulatory guidelines, such as those established by the Undersea and Hyperbaric Medical Society (UMS) and relevant accreditation bodies, which mandate that treatment modalities be appropriate for the patient's condition and delivered in a safe and effective manner. Selecting a chamber that can accommodate the patient's size, mobility, and any necessary support equipment, while also meeting pressure and gas delivery requirements, is paramount. This ensures that the treatment can be administered as prescribed without compromising safety or efficacy. Incorrect approaches analysis. One incorrect approach involves prioritizing cost-effectiveness or ease of operation over patient suitability and safety. This could lead to the selection of a chamber that, while cheaper or simpler to manage, is not adequately equipped to handle specific patient needs, e.g., a multiplace chamber for a patient requiring constant one-on-one monitoring that is better suited to a monoplace chamber, or a monoplace chamber for a patient requiring complex adjunctive therapies, best delivered in a multiplace environment. This failure to match the chamber to the patient's clinical requirements violates ethical obligations to provide the best possible care and regulatory mandates for appropriate treatment delivery. Another incorrect approach is to solely rely on the chamber manufacturer's recommendations without independent clinical assessment. While manufacturers provide specifications, they may not fully account for the nuances of individual patient conditions or evolving clinical best practices. This can result in a mismatch between the chamber's capabilities and the actual treatment needs, potentially leading to compromised care and noncompliance with standards that require the technologist to exercise professional judgment. A third incorrect approach is to select a chamber based on its aesthetic appeal or perceived prestige rather than its functional suitability. This is a clear ethical lapse, as patient well-being and treatment effectiveness must always supersede superficial considerations. Such a choice would likely result in a chamber that is not optimized for the intended clinical applications, leading to potential safety hazards and suboptimal outcomes, and failing to meet the professional standards expected of a certified hyperbaric technologist. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a comprehensive patient assessment, including their diagnosis, comorbidities, mobility, and any specific monitoring or support requirements. This assessment should then be cross-referenced with the technical specifications and operational capabilities of available hyperbaric chamber types, monoplace, multiplace, etc. Consultation with the hyperbaric physician is crucial to ensure alignment with the prescribed treatment plan. Finally, adherence to institutional policies, UMS guidelines, and any applicable accreditation standards will guide the selection of the most appropriate chamber, ensuring both patient safety and treatment efficacy.